Well, it was about maybe a week. My stomach was burning and it was painful. I just remember just calling them, telling them, you know, I don't know what's going on.
When a 911 call comes into us, it starts in our dispatch center. They try to triage whether it's an advanced life support call or a basic life support call. If it falls into the basic life support call category, then we send out the mobile health team.
Mobile health responding.
The lady and the man who picked me up explained the whole thing as they were assessing me. And I'm thinking maybe it would be better so I'm not sitting there for hours at the hospital.
Part of it out in the field is that Cam and Steph are making sure that people want to come here. No one's coming here that doesn't want to come here. So that's been number one. Number two, when they come and see, okay, I can get the same care and perhaps, you know, better in terms of the coordination with the primary care, they've been happy.
I really do think it was a good idea because my experience with it was amazing.
Basic life-saving equipment.
This mobile health initiative was something just that came out of left field. It was a creative, new way of thinking, and it was thinking about the healthcare system and saying, we've got to do something different. We've got to figure out a way to better serve our members and save money at the same time, and this really hit the mark.
The 911 system is overwhelmed. People use the 911 system for all sorts of needs that aren't necessarily emergencies, and we're trying to change that system.
Now, have you come to our health centers before? We were working with the fire department on trying to reduce the number of calls. So with our express clinic, it sort of came up in a joint discussion with them, and it sort of led to this.
That's mobile health respond to North Main Street.
The mobile health initiative is designed to combat the basic life support runs or the low acuity runs and free up our advanced life support units and get people who call for what seem to be non-emergencies to the Providence Community Health Centers Express Clinic rather than tying up the emergency room, and also directing them to primary care if they don't have primary care. So then they can eventually start using a primary care physician instead of calling 911.
Chief Kenyon said, look, the one challenge we have is actually getting our hands on a vehicle. So we said, we'll take care of that. So we bought the vehicle and they got it ready and prepped. They found two fantastic staff folks to do the work. And here you go, right behind me is the vehicle ready to rock.
The benefits are manifold. Fundamentally, it reduces overcrowding in the emergency room and allows our members and Providence Community Health Center patients, as well as other people in the community, get quick access to primary care.
Hello, how are you? Nice to see you again. I think we all know that healthcare is not functioning the way that it should function to be maximally efficient and also maximally helping patients. So it's something that we're constantly thinking about. How can we fix this system? How can we improve on it? And this program, Mobile Health Initiative, really has been great in terms of at least tackling one component of the system.
Providence Community Health Centers was one of the founders of Neighborhood 25 years ago. To me, we've always been joined at the hip because our mission is their mission, and if we can do things better in a partnership and be more effective, then the state wins, the taxpayer wins, and the patient wins.
We want to collaborate with all of the community because our members are part of the community. They're challenged by the things that are challenges to the community today.
Neighborhood Health Plan, I think its bedrock is working with great partners throughout the state. And we're fortunate in this particular initiative, the City of Providence with Mayor Alorza and Chief Kenyon, bringing an idea like this forward. Working with the Providence Community Health Center, which has probably some of the best leadership in the state.
We started in the last week of August. We have had 420 patient contacts. We've diverted 102 of those patients to either Providence Community Health Center or BH Link. If you think of the 102 people who have already possibly gotten primary care, no longer using the 911 system for non-emergencies, and the amount of dollars saved for that person going to an express clinic versus an emergency room, I think we're on the right path.
We're very excited that it's on the right track, and we don't see it stopping.
In Providence, we have approximately 35,000 EMS calls a year. About a third of the calls we get to the 911 system end up being transported to the hospital as basic life support. That's what we're trying to target. That's what we're trying to change. So if we can take those 12 to 13,000 runs and get those people better care, free up our resources, then I think we've won.